investing in rural health care. This is Governor Greg Abbott signed a pair of bills earlier this week. Adam Schwager breaks down how these new laws can help rural Texans get a better and faster health care experience.
According to the Texas Association of Rural and Community Hospitals, over 20 rural hospitals have closed in the last 15 years, leaving communal holes in health care. On Tuesday, Abbott signed a pair of bills to bolster the industry. The first, a sprawling bill known as the Rural Healthcare Stabilization and Innovation Act, an all-encompassing approach to improve the bottom line of rural hospitals. This includes grants for hospitals at risk of closing, grants for hospitals facing emergency hardships, grants for rural hospital innovation, and grants for rural hospital long-term stability and support.
It grants $172 million in new funding, and then continued that with $52 million for funding for existing programs.
Abbott then signed a bill establishing the Rural Ambulance Service Grant Program to address what are called ambulance deserts, where the nearest ambulance station is at least 25 miles away. Right now, nearly 95% of Texas counties have at least one ambulance desert, which this bill attempts to change. Abbott says he understands the importance, recalling a medical crisis that changed his life.
I can vividly remember like it was yesterday when that tree hit me in the back and fractured my vertebrae and my spinal cord, and I was laying on the ground awaiting an ambulance to pick me up. For me, I was only 2 miles from the Houston Medical Center, but it seemed like it took 2 days. What's happening to the people in all of our rural reaches across the entire state of Texas, I cannot even comprehend.
These bills were actually already law as of September 1st, and this signing builds off a conversation had a month ago when U.S. Secretary of Human and Health Services Robert F. Kennedy Jr. showed up to the Capitol to pledge funding for rural hospitals across the nation. In Austin, I'm Adam Schwager.